see a lot of patients who are old, elderly. Now, if you look at constipation, I think the biggest group of people who actually get constipated are older people. You might get younger ones like those with anorexia or bulimia, but actually those are quite, numbers wise might not be so many. But as the world is aging, and here in Malaysia we have aging population. You can see in Malaysia now, right now there are almost 3 million people above 60. So you're looking at a lot of people when they are older. Constipation is one of the big issues, and a lot of old people actually face this problem, and that's not because of just the age alone. It's also multiple factors. These are people who probably don't eat the right diet, not enough fiber, don't take enough water, because they don't want to run to toilet too often. They don't exercise at all. They have multiple medications for other diseases that also affect their bowel movements, and then they get a lot of medication like antibiotics for whatever reason that destroys their good gut bacteria. So that leads to inflammation of the bowel. So there are many reasons why elderly people have constipation problems, and then because of that they end up taking too much of laxatives to solve the problem, and then overuse of laxatives causes another problem where you got a lazy bowel syndrome. So these are some of the things that will happen. So in our country with a big aging population, I think constipation is one of the things that my patients have a big problem. And this is some issue, and because it seems so simple, sometimes neglected. People think they look at bigger issues. They think constipation are just part of aging, and actually they can cause a lot of issues, a lot of problems, a lot of discomfort for the patient as is old. So it must be tackled, must be treated.
Doctor, you mentioned the lazy bowel syndrome, right? Can you care to explain a little bit more about it?
Yeah, I think one of the reasons, again, lazy bowel syndrome in older people especially is again coming back to their lifestyle. Poor diets, very low fiber, no water, lack of exercise, and chronic abuse of laxatives. When they have this problem, and again, laxatives are something that you don't need a doctor's prescription. You can just go to a pharmacy, you can just buy off the shelf and take. And you take it once, you feel good, you have good bowel movement, then it becomes like an addiction. People, whenever they can't pass, they take it, not realizing that long term, especially the laxatives that cause bowel constriction. There are different types of laxatives. Some are just softeners, some osmotic agents, but the ones that actually make your bowel contract to pass, they are very effective. But long term, as you keep on taking, the bowel keep on, getting more and more tired and lazy because they stop reacting to the medication. Imagine someone trying to keep on pumping, after a while the body can't respond. So this is what we call a lazy bowel syndrome. Even though they're taking the medication, the bowel can't, don't have the energy to contract anymore. And this actually becomes a big issue. Lazy bowel syndrome will then actually lead to other medical complications. So if possible, it must be prevented.
This is some sort of like a dependent or
Again,
abused or addiction to
I think all the
laxative.
words are right. Addiction, abuse, dependent, all of them. Just like I know people who, because of chronic pain, keep on taking Panadol, for example, and becomes very dependent. After a while, the efficacy goes away. The Panadol won't work, then they take stronger medication. Same way with our laxatives. After a while, it doesn't work, so one don't work, then they take two. Then that doesn't work, they take four. Ultimately, it can cause a problem.
Is there like a general formula whereby the usage of laxative is actually considered as an addiction or over dependent?
Yeah, the moment if you need laxatives like these motility ones every day, and at least you take more than 2 or 3 a day, then basically you are probably already having an addiction. That means without the laxatives, your bowels are not moving. So that means it's already a problem that you have to settle.
Yeah, Doctor, just now you mentioned a lot of issues and factors causing the aged patients to have constipation problem. Are they the group of people that is the most high risk group?
Yeah, I mean, if you look at constipation, I think it's not the younger ones, seldom younger ones, unless, like I said, they had disease like anorexia or bulimia, where they don't eat or they just vomit out whatever they eat. Then they might have constipation. But most young people are normally quite mobile, unless they got some rare disease that can cause that. But mostly it's the elderly.
Can stress cause constipation?
Stress can actually cause more. It can be either way. Sometimes most likely stress causes diarrhea, because you get anxiety, so you get diarrhea. But sometimes, rarely, it might cause constipation, especially medication to relieve the stress. It's more the medication side effect rather than the stress.
Okay. So is constipation preventable?
I think you should try to, because it's just a lifestyle disorder. It's simple things like eating the right amount of diet fiber, soluble fiber, non soluble fiber, making sure that you're taking enough water content because water is important. Exercise, just walking, movement, very important. A lot of time older people get lazy or they sometimes they just for other reasons, they got arthritis or they got other problems, so they're not mobile. And it was important the exercise is actually one way of making your gut move. So our body is like a machine. If you don't move it, it becomes like a car that doesn't start or get rusted. Same our body, so everything will move accordingly. So you must exercise. Make sure that your gut bacteria are looked after. A lot of people forget that part of the body. We have 1 trillion cells in our body, but we got 3 trillion bacteria in our body. We got actually more bacteria in our body than our cells. So you can see that this is at least something from time of caveman evolution. So the good bacteria are very important to our health, and sometimes because of medications, poor diet, antibiotics, all that, we destroy that bacteria. A lot of time people end up taking too much of food that are chemical based, a lot of preservatives, all that. We find that actually sort of destroy our good bacteria, and that itself will lead to constipation. So all these are factors you have to look at.
Yeah, doctor, you mentioned about fiber, right? And a lot of people have actually like habit taking fiber. Do you have anything like to say on this, and how should they actually deal with their fiber intake, and what is like a proper way?
I mean, if someone is having a good healthy diet, the recommended 4 to 5 portions of fruits and vegetables a day. I mean, that's now everyone talks of it. If you can take that much, I think fiber not an issue lah, because you're taking good fiber from the diet. But again, when you're older, many reasons why people don't want to take that. One is the chew, their problem with their teeth, chew fiber, not easy to digest fiber, not that easy for them. They get instead of getting sometimes fiber can cause too much of weight, flatness in older people. So all these issues. So sometimes older people themselves don't take too much of fiber, and so that is actually one big problem. Not enough fiber, and then like I said, they don't take enough water because for them they don't run toilet very often, so they try to keep avoid taking too much water. So all these actually aggravates the situation.
So is there like a difference in soluble and insoluble fiber in the intake?
Basically, the soluble fiber are the ones that actually get digested. And insoluble is the one that actually helps us move for the roughage and the bowel movements. And actually, these are both important because they actually act as prebiotics for the probiotics for our good bacteria. So these are important. These are like a culture for the good bacteria. So you need both actually to help improve your bowel movements.
So with the right type of probiotics and enough fiber, right? What is the importance? Why do we need this kind of balance in our diet?
Actually, a lot of people don't understand the reason we take fiber is, of course, one is for bowel movement, and of course most of the time the soluble fiber like vegetables and all have a lot of good nutrients inside, but it's the looking after the gut health actually is very important. I think from ancient times, Hippocrates said that the disease starts in the gut, and that we all know. A lot of people forget that your immune system actually is looked after by the good bacteria. It's a good bacteria that educate our immune system how to fight infections, fight cancer. And people with bad gut bacteria actually have what we call a leaky gut syndrome, because when you don't have good bacteria protecting your gut, the body actually loses that balance. A lot of toxins actually enter to the gut, and these are toxins that go and cause havoc in the body, from autoimmune diseases to increasing the risk of cancers and everything. So that is actually our first protection, and a lot of people don't realize that it is the bacteria in the gut that is actually our first soldiers to our immune system. So when we destroy that good bacteria, and I think a lot of us today actually have that problem because we eat a lot of refined carbohydrates, because of saturated fat, too much of preservative chemical foods, take antibiotics, and this good bacteria actually lose out, and then the bad bacteria will take over, and that's when all the disease process actually they say start from there. So this is actually the first protection for us. So it's very important that it should maintain a good bacteria.
Okay. So how do we choose like the best fiber product that contains probiotics? What are the criteria that lay people could understand in picking the right?
I mean, again,
Fiber.
it's looking at the type of fiber that you have. For example, the fiber content must be important. I think a lot of people who can't take food that contains high fiber then should look for alternatives. And that's when they should look at a brand that has got good fiber content. For example, oats want good fiber content, and also the type of bacteria that is available. Actually, I've never seen products until now where they can keep both in together. Fiber plus probiotics. A lot of times you actually have to take them separately, but both are important because if you can take fiber, then these are the place where the good bacteria grow. So you need they are like the prebiotics. So you take fiber, you have good bacteria together, they grow very well. It's actually the ideal solution for even your constipation. So this is more into prevention, not for treatment. So taking a regular fiber plus probiotics actually is a good way to prevent your constipation. At the same time, make your gut very healthy. Actually, in the long run, it also helps you to be healthy. Because like I said, the gut is where a lot of diseases start.
Okay. Yeah. Do you have
You
any
covered
extra
everything,
questions?
or do you want to add on more things?
I have some questions.
Yeah.
Who are the people that cannot take this type of fiber or probiotic?
Yeah. Actually, normally it's not a problem. Sometimes some people when they take this fiber and probiotic get a lot of indigestion problems, flatulence and all that. So what you can do is start with lower quantity, start slowly. Don't ask them to take too much in the beginning, and once they get adjusted, it shouldn't be a problem. At the same time, sometimes fiber also helps reduce your cholesterol levels. So that's another good advantage because 40% of cholesterol gets excreted and reabsorbed. So sometimes the fiber will actually bind with this and take it out. So that also helps. So you got other benefits also.
Is it pregnant woman and infant also can take this type of probiotic or fiber?
Infants, I'd be a bit careful because I think I'm not sure they should be able to give for infants. Pregnant mother shouldn't be a problem, but make sure they don't take too much where they get diarrhea. Then you worry about pregnancy. Mother shouldn't be a problem. In fact, they have pregnant women sometimes have constipation problems.